Hello, I'm Dr. Shamim's AI assistant and like to welcome you at our platform, Ask Surgeon Shamim. Today, I'm going to share something that could dramatically change your surgical experience and potentially save your life. In surgical practice, we've noticed a troubling pattern. Over 70% of patients sign consent forms without fully understanding what they're agreeing to. They don't ask the critical questions that could protect them from complications, speed their recovery, and give them peace of mind. Whether you're preparing for surgery next week or just exploring your options, these 10 questions are essential. Research shows that informed patients have 40% better outcomes, experience less anxiety, and recover faster. So let's dive in. By the end of this video, you'll know exactly what to ask your surgeon and why each question matters. This is the foundation of everything. You need to understand not just what surgery you're having, but why it's necessary specifically for you. Ask your surgeon to explain your condition in plain language. What's actually wrong? What tests confirm this? Many patients arrive at consultations after rush DR visits and haven't had time to process the diagnosis. There's no shame in asking for clarification. Next, ask about alternatives. Surgery is rarely the only option. What about medications, physical therapy, or simply monitoring the condition? For example, early gallstones might be managed with diet changes, while advanced cases require surgery. Finally, understand the timeline. Is this life-threatening within hours, or can it wait weeks? This helps you plan or even seek a second opinion if time allows. Every surgery carries risk. Before proceeding, understand what happens if you choose differently. Ask your surgeon, what's the natural course of this condition without surgery? Some conditions improve on their own. Others worsen slowly, giving you time to prepare. For instance, a small hernia might remain stable for years, while acute appendicitis requires immediate intervention. Be honest about factors affecting your decision: financial concerns, work commitments, family responsibilities. A transparent conversation helps your surgeon give you realistic guidance about what can safely wait and what cannot. The surgical approach significantly impacts your recovery, pain levels, and scarring. Open surgery uses larger incisions, typically means more pain and longer recovery, 4 to 8 weeks, but gives surgeons better control in complex cases. Laparoscopic surgery uses small incisions and cameras. Less pain, shorter hospital stays, faster return to work, typically 2 to 4 weeks. Robotic surgery offers extreme precision with minimal invasiveness, recovery as quick as 1 to 3 weeks, but it's more expensive and not universally available. Here's what matters most. Your surgeon's skill and experience with their chosen technique is far more important than the technology itself. Don't be afraid to ask, why are you recommending this approach for me specifically? Every surgery has risks: infection, bleeding, blood clots, and anesthesia reactions. Ask about the specific percentages for your procedure. Clean surgeries like hernia repair have infection rates under 2%, while intestinal surgeries carry higher risks. Now here's what's crucial. Your personal health significantly affects these risks. Diabetes increases infection risk 2 to 3 times. Obesity elevates anesthesia risks and complications. Smoking dramatically impairs wound healing. Heart disease may require additional monitoring. Be completely honest about your health history. Patients sometimes hide smoking habits or fail to mention medications due to embarrassment. Remember, medical confidentiality is legally protected. Your surgical team needs complete, accurate information to keep you safe. Beyond general risks, ask about complications specific to your operation. For thyroid surgery, there's a small risk of vocal cord nerve damage. For joint replacement, dislocation matters. Understanding these helps you know what symptoms to watch for afterward. Anesthesia anxiety is extremely common. Many patients fear it more than surgery itself. Let me help you understand. There are 3 main types. General anesthesia puts you completely unconscious. Regional anesthesia, like spinal or epidural, numbs a large area while you remain conscious or lightly sedated. Local with sedation is used for minor procedures. You're deeply relaxed with little memory. Modern anesthesia is remarkably safe. According to research published in Anesthesiology Journal, the risk of serious complications in healthy patients is less than 1 in 100,000, statistically safer than driving to the hospital. Come to your pre-anesthesia assessment with a complete list of all medications, supplements, allergies, previous anesthesia problems, and any dental issues like loose teeth. This information is critical for your safety. This affects everything: work arrangements, family responsibilities, financial planning. Get realistic expectations. Some surgeries are outpatient. You go home the same day. Others require days or weeks in hospital. Ask about the typical stay for your procedure and what might extend it. Get specific about activity restrictions. When can you shower? Drive? Return to work? Lift children? Exercise? Don't accept generic advice. Get guidance relevant to your life. Recovery timelines differ dramatically for desk work versus manual labor. An office worker might return in a week after laparoscopic appendectomy, while a construction worker might need 4 to 6 weeks. Be honest about what your job actually entails. Here's what surprises patients: recovery is rarely linear. You might feel good on day 3, then exhausted on day 5. Pain typically peaks around day 2 to 3, then gradually improves. Fatigue for weeks is completely normal after major surgery. Proper preparation reduces complications and speeds recovery. This is where you have real control over your outcome. First, medications. Some increase bleeding risk and should stop 7 to 10 days before surgery. Aspirin, ibuprofen, fish oil, vitamin E, ginkgo. However, never stop prescription medications without explicit instructions. Blood pressure and heart medications usually continue. Second, fasting rules. Typically 6 to 8 hours for food, 2 hours for clear liquids. Following these instructions precisely is critical. Food or liquid in your stomach during anesthesia can cause aspiration, a potentially fatal complication. Third, preoperative testing. Most surgeries require blood work, ECG, and possibly chest X-ray. Fourth, lifestyle preparation. If you smoke, stopping even a few weeks before surgery significantly reduces complications. Optimize your nutrition, manage diabetes control, and exercise regularly if your condition allows. Finally, arrange transportation home. Prepare your recovery space, stock easy-to-prepare foods, and arrange help with children or household tasks for the first week or 2. Understanding what's normal helps you distinguish routine recovery from complications. You'll wake in a recovery room with nurses monitoring you. You might feel groggy, cold, or nauseous, all normal. Tell your nurse about nausea immediately. Excellent medications are available. You might have various tubes and equipment, IVs, oxygen, monitoring leads, possibly catheters or drains. Each serves an important purpose, and most are temporary. Pain should be manageable, not unbearable. Don't try to tough it out. Adequate pain control actually speeds healing by allowing you to move and breathe deeply. However, communicate with your nurses about balancing pain control with side effects like nausea. You'll be encouraged to move and walk even though it's uncomfortable. This prevents dangerous complications like pneumonia and blood clots. Early mobilization is now standard. You might walk the same day as your surgery, even after major procedures. This could literally save your life. You need to recognize warning signs that require immediate attention. Seek emergency care immediately for high fever over 38.5 degrees Celsius or 101.3 degrees Fahrenheit with chills, severe pain not controlled by prescribed medication, difficulty breathing, shortness of breath, or chest pain, heavy bleeding that soaks through dressings, one-sided leg swelling with pain could indicate a dangerous blood clot, wound problems increasing redness, pus, wound opening, or red streaks, inability to urinate or severe abdominal swelling, neurological changes, confusion, weakness, vision changes. Some concerns warrant a call to your surgeon but aren't emergencies: mild nausea, constipation, questions about medications, or minor incision concerns. However, if you're uncertain whether something is serious, err on the side of caution. It's better to be evaluated and reassured than to ignore a genuine problem. There's no embarrassment in seeking evaluation. Continuity of care between discharge and follow-up is critical. Ask for specific contact information, clinic phone number, after-hours line, or patient portal access. Know who to contact outside normal hours. Is there an on-call system? Clarify what issues you should call about versus what can wait for follow-up. Most surgeons want to hear about fever, unexpected pain, or concerning symptoms. Understand the follow-up plan. When is your first post-operative appointment? Will you need dressing changes or suture removal? If you had tissue removed, when will pathology results be available and how will you receive them? Many healthcare systems now offer telemedicine for routine post-operative checks. Ask if virtual follow-up is appropriate for your procedure. Request copies of your operative report, pathology results, and discharge summary. You'll need these for future care, second opinions, or insurance documentation. So there you have it, the 10 essential questions every patient should ask before surgery. Good surgeons welcome these questions. They understand that informed patients have better outcomes, less anxiety, and smoother recoveries. If a surgeon seems irritated by your questions or dismisses your concerns, that's a red flag worth considering seriously. Remember, ask every question. Prepare thoroughly. Know the warning signs. Trust the process, but verify everything. Surgery might feel overwhelming, but knowledge is empowering. Use these questions to prepare for your consultation. Write them down. Don't leave until you feel comfortable proceeding or comfortable seeking a second opinion. We've created a comprehensive article with detailed explanations of all 10 questions, scientific references, and additional resources. Visit surgeonshamim.com to read the full guide and download your free printable checklist. If you found this video helpful, please give it a thumbs up. It helps this information reach more people who need it. And if you want more evidence-based medical advice explained clearly, subscribe to Ask Surgeon Shamim and hit the notification bell. I regularly share practical medical information that helps you make informed decisions about your health. I'd love to hear from you. What question would you add to this list? Have you had surgery before? What do you wish you'd known? Share your experiences in the comments below. Your insights might help someone else. I'm AI assistant of Dr. Shamim, and thank you for watching. Remember, you're your best advocate. Stay informed, stay safe, and don't hesitate to ask questions. I'll see you in the next video.